Powell, and I'm so glad that you decided to join me today because guess what? It's back to school. Yay! I know. Get ready for the traffic and plan your time. Give yourself at least 15 to 20 minutes extra time because you don't want to be stressed. And with that vein, I want to introduce my guest for today. I did promise you we're going to have two conversations today. One really important conversation is it's we're going back to school, and some children have already been diagnosed with attention deficit, and some may be diagnosed in the school year. And I have an expert here with me, Dr. Gillespie Johnson. Dr. Gillespie has been a nurse practitioner, psychiatrist for how many years? Too many to talk about, right?
Yes.
But easily, as long as I've known her, at least 25 years. And more importantly, this subject of attention deficit, it's kind of scary for many people in the community. And why do I say that? I've met many family members in my practice who have allowed their kids to go to school without medications prescribed by their psychiatrist. They've been anxious about getting a name put on their child, and these children have suffered because they have not been getting their medication. They've been labeled, contrary to what the parents think, that the label of ADH was going to stigmatize them. But even more, as Dr. Gillespie will tell you, that stigmatization is worse when teachers will be whispering in the hall saying, that one's a bad one. Oh, that one got issues. And the child is not getting the treatment that they need, which makes their studies take longer, their grades fall. So I brought in Dr. Gillespie here, who's a specialist in psychiatry, nurse practitioner, contraceptive medicine, healthcare in all of its modalities. And this is one of the areas I know that she is definitely interested and want to educate. So tell us, Dr. Gillespie, what is attention deficit?
Okay, thanks for having me here today. Um, the proper name is attention deficit hyperactive disorder, otherwise known as ADD. And this is not a disease.
Yay.
Contrary to what a lot of people think that it's a disease, it's not a disease. ADHD is a behavioral syndrome that is characterized by persistent presence of 6 or more symptoms. One, you have inattention. 2, you have impulsivity or hyperactivity. And 3, you have a combination of both.
Wow. So does that mean that if my child can't sit still, they're running around the house, they don't focus, that they have ADHD?
No, it doesn't mean that. That may be one of the symptoms that they have.
Shucks. Okay.
One of the symptoms that they may have may be running around, cannot sit still, but it's not necessarily ADHD. It
Okay.
may be some other mental health disorder. I'm not going to say it's mental illness because of the stigma. I'm going to say it's a disorder of mental health. So some of the symptoms for inactivity or inattention is failure to complete tasks or to listen carefully, difficulty in concentration, and distractibility. And that's the inattention. The impulsivity or the hyperactivity maybe when they are in school, blurting out answers, they cannot wait, they are impatient, they are restless, they fidget. When they come to the office, they touchy, they do everything. They have difficulty organizing their work at home and at work. You'll see their drawers or their bedrooms is all over. They just go all over and they go from one topic to the other. They don't want to take or wait their turns for anything. If they have siblings, me, and then the next person, and then the next person, they jump in front of them.
So, Dr. Gillespie, but doesn't that mean my child is smart? I mean, my child wants to answer all the questions. you know, and so he knows that some of the other, and this is parent talk, they know that the other kids don't know the answer. At least that's what my child tells me. And I'm just not disrupting the class, mom. I just want to answer the question.
Yes, you can answer the question, but there comes a time when you need to do your turn, and you don't want to wait your turn. You you can wait your turn. You can answer the question. Me, miss, can I? But the inattentive one, do not do that.
Okay, okay. So let's be clear. So we've been given by Dr. Gillespie some real hallmarks. You know, the fact that a child wants to answer questions doesn't mean that they are not having hyperactivity and inattentiveness. The fact that they think they know the answer, they can't wait, you know, they have no patience, and no matter how many times you tell them, please wait your turn, they're insistent. And so the child that has a messy room is not just that they don't want to clean their room, it's a possibility that it's disorganized thinking.
Disorganized thinking.
Okay.
And of note is that these symptoms usually are noticed before the age of 7.
Really? Wow.
And they are observed in more than one setting, and this is key. You will find out that they do that at home, they do that at church, they do that when they go to the movie and at school. And thanks to all the teachers, because most time the teachers are the first one to observe it or say it.
Yes.
They may not know that it's ADHD, they may not be able to diagnose, but they can see the children behavior, and they may want to have a talk with the parents and said, maybe you want to check him out because he cannot sit still in the class, he's inattentive, on all of those symptoms.
Well, what about when a parent says to you, the teacher wants me to test them for this disorder, but my child sits and watch a movie. He'll sit there and play his video games for hours. I don't understand why he's such a problem in school.
Okay, he may be, I'm saying he, easier to say he or she, may be doing something they like, and they may be paying attention to that. But you will observe that they get up and they move, or they move from, you're not watching them, so they are moving from one character to the other one. They are watching it, but you think it's one thing they are watching, which is not necessarily true.
Wow, that's really interesting. So, what is the actual plan of care for a child that we want to succeed? The whole idea of this conversation for parents and family members that we want our kids to succeed when they go to school. What can we do?
Okay, the first thing is that they have to be diagnosed. Remember, it's not a disease. There's no objective testing for ADHD. It's a combination of um, screening tools that we use as well as psychiatric evaluation. They are usually diagnosed by a mental health provider, occasionally some neurologist and a pediatrician. A primary care provider may also observe and they may refer them. So that's the first thing. They are going to tell you they need a test. There is no test, there's no blood pressure test, there is no blood work, there's no imaging, there's no screening. It's a cluster and a combination of behaviors.
Wow. So once we have those tools or see the mental health specialist, um, and yes, the child is diagnosed with this disorder, um, what next?
Well, it's important for them to be assessed because sometimes we may see all the symptoms that are relevant to ADHD, but they are not actually ADHD. It may some other mental health disorder because it may mimic bipolar, it may mimic anxiety, they may have experienced some trauma, they may have experienced depression, grief, so you have to diagnose them. If they are diagnosed with true ADHD, there are 3 different treatment plans. One, medication. First medication is a stimulant which is highly addictive. Second one is a non-stimulant. And the third one is one that was just released by the FDA, Food and Drug Administration, in April, and it's a device, an electronic magnetic device that they use,
Wow.
and it's fairly new. That is not medication. I do not use that as yet because it's April 2025 it was released,
Okay.
and that is one. In addition to that, we have therapy, behavior therapy, and not only for the child, but also for the parents.
Wait a minute. Wait. You said parents.
Yes,
Doesn't
parents.
isn't the child the one with the problem?
The parents have the problem as well
Oh.
because you have to deal with the child.
Mm.
This is your bad child. This is the one the teacher is calling you every day at school. You have to go to work. You have to provide.
Yeah.
It's causing you additional stress. So you have to learn how to deal with this situation.
Gotcha.
Therefore, we have therapy for the child that is involved, the siblings, the parents, the other family members that are involved.
Wow.
So it's a community effort.
So, and I'm glad you mentioned that it's not just the child. And sometimes an island is created that this is the child and this is their problem. But as you said, parents have to engage with that child and also create the environment. And more importantly, because they are a child, you're responsible as a parent or caregiver to get them to their therapy, to get them to school, to have those conversations with the educators when they start school, and throughout the year to track and follow and see how well your child is doing. You cannot raise your hands up and say, well, I don't understand. As Dr. Gillespie said, it's a family care that's needed.
Yes. Very important. You have to consider the cultural differences as well.
Yes, please.
Because some people may say, oh, these are normal childhood behavior. Nothing is wrong with them, so they deny them the proper care. Two, they may say, oh, they will grow out of it. But instead of growing out of it, they are getting more into it.
Wow. Well, I am so thankful that you came to have this conversation with us, Dr. Gillespie. And if you do need some assistance, we will post in in our Facebook space and comments address for Dr. Gillespie if you need to have further conversations and other healthcare providers. Please do not withhold care for your child. Please get the help your child needs, and also if they need to be evaluated. Thank you so much, Dr. Gillespie. We appreciate you, and we will have you come back to go deeper and take a deeper dive in this topic. Thank you so much. And family, get ready. We're going to be talking about immunizations.
Thank you
Dr.
very
Douglas.
much.
Thank you. So you got to get immunized. If your child is just starting school, they're first time going to be with other kids, they're going into preschool or VBK, and they said, excuse me, we need your health records. Your child cannot come in without the health records. What can you do? Well, we have our guest here. This is Dr. Chavez. Thank you so much for coming.
How are you?
Yes,
Pleasure to
yes.
be here.
And it is my pleasure to have Dr. Chavez here with us. He's a graduate of the University of South Florida Health Orsani College of Medicine in 1993, and he works in Miami, Florida, and he is also specialized in pediatrics and critical care medicine. He's affiliated with Baptist Hospital of Miami. And I have to say, Dr. Chavez, first of all, thank you so much, as well as Dr. Gillespie. Will be here on Saturday at Norwood Park. We're going to be doing physicals for children who have not had their physicals, so please be there between 9 and 12 on Saturday. But tell us, Dr. Chavez, you work in critical care.
So I am a graduate of the University of South Florida in Tampa. I did fellowship in pediatrics for 3 years. Residency in pediatrics at All Children's Hospital in St. Petersburg, and then a 3-year fellowship in the pediatric emergency medicine at the University of Minnesota. I work at a whole children's hospital and Jackson Memorial Hospital. I used to work at Baptist, but I've been at Jackson for 20 something years now.
Oh, wow.
Yeah, and yeah, I did graduate in 1993, but I was 5 at the time, just to let you know.
Nice, nice, nice. Thank you for that. So we're talking about immunization, and this is big. We have right now a population saying no immunizations, yes immunization, but at this point, quite a number of schools are still requiring immunization. Could you tell us more about why immunizations are important?
So I'm not a primary care provider. I'm an emergency physician. So no one wants to see me, and I get it. If your child is not immunized, they're at a high risk of severe illnesses and complications from illnesses that normally would be treated or prevented with immunization. So any kid who comes in who is not immunized, especially nowadays, is at risk of having um, uh, meningitis through strep pneumo, Haemophilus influenza. We all hear about measles, we hear about pertussis, but there are multiple other illnesses that are treated with immunizations that are preventable if your kids get immunized. The other thing, like you mentioned, there's a decrease in the amount of kids who are getting immunized in Florida and throughout the U.S.
Yes.
There's something called herd immunity, which means if everyone around you is immunized, there's less likely that that disease is going to be transmissible to other people and to those who can't get immunization, such as cancer patients or kids who have a congenital immune system that doesn't function as well. Once that level of people immunized get low, there's a higher chance that disease is going to spread throughout the community. So it's extremely important for your child to be immunized prior to school. If you get to the emergency department and you have a fever, which is where I'm going to see you, the workup that I'm going to require to do on a child who's not immunized is much different than a child who's immunized, because I have to look out for your child, and I may need to get blood tests or certain other things where a kid who's immunized, that wouldn't be necessary. So you're not only exposing your child to illnesses, but unnecessary, maybe procedures that would be unnecessary and healthcare costs that could be avoidable.
Wow. So in the emergency room, I know, as you just said, additional tests maybe your child may have to undergo because they're not immunized. So you're saying kids who are not immunized run the risk of having, even though they're trying to, parents are trying to avoid exposing them to a vaccine, they may be exposing them now to having to get complete and more intense workups.
For sure. And more importantly, they're exposed to the disease itself. I mean, things that we haven't seen before in such a long time, or we didn't see as much as measles. I worry more about strep pneumo and Haemophilus meningitis.
Could you tell us a little bit about those? Because the Haemophilus, usually kids obtain those vaccines before the age of 1 year of age. And for parents who avoid giving those before 1 vaccines, you've seen them critical. Give us a description of what a really sick child who's not had their pneumonia and their Haemophilus vaccine.
Well, if I have a child who is, let's say, 7 months of age, so the mother passes antibodies through the child in utero during the child has as protection the first 6 months of age. In the first 6 months, kids get vaccines at 2, 4, and 6 months, and that helps as the mother's antibodies go down, the kids build in their own the antibodies through the vaccines. So by the time they get to be 6 or 8 months, they are protected as the mother's immunization winds down. I have seen kids with meningitis, with pneumonias, bone infections, sepsis, who are critical and that could have been avoided if those kids would have been immunized. Those kids get sick fairly quickly. They have a fever, and normally the antibodies caused by one of those bacteria, the antibodies in your body through immunizations will protect you against it. And if you don't have those, that can spread and cause chaos. Just rapidly go through the system and
Dr. Jones, you mentioned fever. And I know a lot of parents, kids are always having fevers. They cut a tooth, they have a fever. They have a runny nose, they get a fever. When should a parent be alarmed that this is not just a cold? This is not just cutting a tooth. This is possibly, as you said, meningitis or pneumonia in a child.
If you're worried as a parent, if you are worried as a parent, then you should have your child checked out. Okay, you know your child better than I do. So it's never wrong to come to the emergency if you're or to or urgent care or to your pediatrician if you're worried. A kid fever in and of itself is not dangerous. It's never the fever. Fever just means it's like smoke. Where's the fire coming from? Okay,
Okay, I love
so
that.
if your child has a fever and then if it's a low fever but the child doesn't look right, it's not acting right, the cry is different, it's breathing is abnormal, then you need to get that child evaluated. There's really not a temperature that's critical. As long as you give the correct dose of antipyretic, Tylenol, ibuprofen, and if your child's active, then it's okay. If I can mention febrile seizures really
Sure,
quick,
please do, yes.
because most parents have the misconception that the temperature is going to keep going up and up and up if you don't do something. And to this day, there's no kid who's spontaneously combusted. They
No,
all
oh
do.
man.
You
So
see,
this is a myth then, that the child's gonna just go to poof.
they don't. So
Because
you
of
want our
fever.
kids to be comfortable, and fever is a good thing. It just means the body's building it's building immunity. But there are subset of patients, the general population, about 2 to 5% of the general population would have febrile seizures.
Mm,
Those are seizures that happen not necessarily with the height of the fever, but just the presence of the fever.
right.
And there's nothing you can do to prevent those from happening. Tylenol, ibuprofen. If your child does have a seizure with a fever, then you just need to call 911. But just know that you cannot prevent it from happening, and it's kids who are predisposed to that, and it's worldwide. Okay, it's
Yes.
not the fever. It's not the height of the fever that causes the
Wow.
seizure.
So it's okay then if I'm not alarmed to send my child to school, even though they may have a little low grade fever.
If your child has a fever, runny nose, cough, congestion, then they're probably going to be contagious. So we normally ask parents from the emergency department to keep the kids at home until they've been febrile for 24 to 48 hours.
You heard that, parents. Okay. If your child's had a fever 24 to 48 hours, please keep them at home, because then it's not just your child taking the time to get better, but you're also protecting the other children in the classroom, as well as the teachers in the community of their school. Sometimes, Doc, we forget that the population of school, you know, is a place where kids are touching one another constantly. And when we have kids who, we take chickenpox, for instance, if we know it's almost eradicated, chickenpox is almost eradicated. And if your child does have chickenpox, please keep them at home. Okay, keep them at
Yeah,
home.
pretty much any contagious disease. If you're aware, you remember that those kids have parents and grandparents. It's not just the other kids in the classroom, but the family members who may be immunocompromised, and it may just be a cold to your child,
Mhm.
but it could be significant and dangerous to other members of the community.
Yes, yes. I think that's a great point. Being immunocompromised, as you said, the elderly, people with cancers, and it could be detrimental to
Yeah.
them. So as you consider, am I going to immunize my child or not? Not only think about the school environment, think about the home environment. Think about the grandparents who are there, the aunts who may be sick, or uncles. We are a community.
We are, right?
And
And prevention is the key for us and for our kids. And one of the biggest things you can do to help your child in prevention is immunize them as recommended by the AAP, American Academy of Pediatrics.
yes, thank you so much for that. Any final words? But please, this is your era, emergency and critical medicine. I don't want kids ending up there unless they have to. Can you tell us a little bit about some of the accidents that you see that are preventable, that could prevent kids ended up in the emergency room?
Okay, so we'll briefly go to a couple of them. I think the number one cause, we should all be aware, we talked about immunizations, and infections used to be the number one cause of death of kids a century ago, but now they're not. Gunshot wounds are the number one cause of death for kids less than 18 years of age. So
Wow.
if you have a gun at your house, make sure that you have it stored appropriately.
Yes.
You have the bullets stored away from the gun. You have them separately locked in boxes, and
Yes.
that you only have access to that. More importantly, if your child is going to someone else's house, um, ask, do you have a
Yes.
gun at the house? Okay,
Yes.
because most significant number of accidents happen at someone else's house. So
Wow.
if your kid's going for a play date or overnight sleep or just to hang out, you say, listen, no, your family is great. Do you have a gun at the house?
Yes.
So that's the number one thing. Number two reason why kids are going to have adverse
Yeah.
outcomes are going to be car accidents.
Wow.
So make sure that your kid has the appropriate car seat booster.
Yes.
It's up until 12 years of age or specific weight at which your child should be protected. If you use the wrong seatbelt,
Seatbelt,
then you can have abdominal spinal injuries.
Right.
There
So
was
going this way instead of where it should be low.
correct. So
Right.
so there's some nice charts. Injuryfree.org is a website that has great information about all types of injury.
Injuryfree.org.
Yeah.
Okay, that's a good one. We're gonna write that in the chat room.
So make sure that you have that. And then concussions and head injuries. If your child's doing anything on wheels, whether it's skateboarding or bike riding or ATV, make sure that you have the helmet and you have the appropriate size helmet. Don't go if it's too loose, it's not going to do
Right,
anything.
just dancing on the head.
I tell all the kids, you only have one brain, you got to protect it.
Yes.
Especially the teenagers to say it's not cool. It doesn't
It's
have to
not
be
cute.
cool.
It's ruining my hair. I can't wear a helmet. Yeah.
Decorate it, do whatever you want to do and then last, we see a lot of poisoning. So most of those are pharmaceuticals, which means medications. So toddlers love to explore. So make sure you keep things locked and away from the reach of the kid.
Pods, those really colorful pods
Yes,
that look
yes,
so delicious.
Yeah, and then they can cause some serious problems. When grandparents visit, the grandparents' medications tend to have a high chance of complications.
Wow.
And in Florida, we've seen a drastic uptick of THC accidental overdoses in kids. There's a nice graph that Jeff Bernstein from the Policy and Control shared with me. And in the emergency department, we've seen more critical cares, more intubated patients over the past few years than we have in the previous 20 years. Just because you got to treat those as medications. If I'm not saying what you should be doing as an adult, but to protect the kids. A lot of those
vaping is
don't vaping, but the edibles look like candy.
Yes,
they look like candy.
Chocolate and gummies.
And we have kids who come in. It says hemp Oreos. 4-year-old can read hemp Oreos. It looks just like an
Oreo cookie,
and they will tear that up. So you got to be careful. Treat all medications or with respect and think about what could happen to your kid if they got into it. If your child does get into it before you go to the emergency department, or if any concerns, call poison control.
Poison control. And finally, I want to recap what you said because we want our kids in school. We want them healthy in school. And we want to keep them out of the emergency room at all possible. So to recap what Dr. Chavez said, if you have a child in your home, think like a child. Think like a child. If it's shiny, pretty, and accessible, they will probably touch it. So keep your weapons high and locked and separated. And if your child is going to another person's home for which you will not be present, it's not rude to ask the questions. In fact, it's a great parent. Do you have weapons in your home? Are they secure? Are they away from the child? And medications. Medications, again, just like weapons, should be high, away, and locked. If you could remember those words, high, away, and locked, because if it's pretty and shiny and looks interesting, like the gummy bears, the THC, an Oreo, now they look chocolate, those are edibles, but they should be, again, high, away, and locked from children. We don't want to hear another story about a child losing their life or being disabled because of not following proper cautions and prevention with our children.
Correct.
Yeah. Thank you so much, Dr.
Thank
Chavez.
you.
We so appreciate you coming. And,
Thank you.
And I'm saying thank you ahead of time for you and Dr. Jalopsy for coming out on Saturday to Norwood. We're doing back to school physicals. For any kids who haven't had theirs, and if you already had yours, have a wonderful and healthy and prosperous new school year. Thank you for joining me on Healthy You, and I'll see you again in September.